Hi, it's Dr. Quinn Throckmorton, and if you are watching this video, it means that we had a discussion in my office about a shoulder replacement. I know that seems like a big deal, and it certainly is. We take this very seriously. I know we went through the pluses and minuses of the surgery in the office together, but just in the interest of reinforcing some of that information and so that you have all the information that you might want to know what you might be able to expect after surgery, we've put together this video that reinforces some of that information. As you might recall, we talk about surgeries with pluses and minuses. From a technical standpoint, a shoulder replacement is just like any other joint replacement. We take out the bad joint, we put in a new metal ball and a plastic socket. So instead of the bones grinding against each other, which can happen with bad arthritis, for instance, it becomes a metal on plastic socket, and that's very effective for pain relief and restoring your function. Similarly, for patients that have bad rotator cuff tears that can't be repaired, we do the operation called the reverse total shoulder, which is also very effective for restoring your function and alleviating your pain as well. On the plus side, about 90% of the time, patients are happy that they had this done. So this is as good an operation as a hip or a knee replacement. It can even be outpatient surgery, and only rarely do people need to spend a night or more in the hospital. So most of the time, folks can go home the day of surgery or the day after. The average function or range of motion after surgery is about 3/4 of normal. So to put that into context, the average patient can get a cup out of the cupboard, they can get to the back of their head and get in their back pocket. So even though we might not be talking about a perfectly normal shoulder like you had when you were 15 or something like that, it's still pretty good function and typically improved for patients from where they were before the surgery. On the downside, the surgery is about a 3-month recovery. And by that I mean there's 6 weeks in a sling where you're really not using the arm at all. The second 6 weeks, you come out of the sling and you're using the arm gently for things like driving your car, taking care of yourself, or playing with your cell phone. At the end of 3 months, you can use the arm pretty much however you want within reason. Because you do have a mechanical joint in there, we ask that you don't do super heavy activities like powerlifting or things like that, but most day-to-day activities are just fine. Things like golfing, yard work, lightweight training, all that's fine. We've even done some work here on shooting of firearms. We know that's a big deal in this part of the country, and shooting firearms, even shotguns and shoulder-mounted firearms, are safe. The physical therapy that you do after the surgery, you can take it any place that you would like. There's no specific place that you have to go. We do it by protocol, so we ask that the physical therapist adhere to a certain set of instructions that we give them. For the first 2 weeks, you do the therapy on your own at home, and we'll instruct you on those on the day of surgery or in the hospital on the day after surgery. At the 2-week follow-up visit with my PA, he will start the physical therapy program with you, and what you do there is you go downstairs to our therapist and they'll instruct you in a home exercise program that you do for the next 4 weeks. So that takes you out to about the 6-week mark. At the 6-week visit, you see my PA again, and at that point you begin formal physical therapy with a physical therapist, again at the facility of your choice. For those first 6 weeks, while you're doing the physical therapy on your own at home, our therapist will check in on you periodically to reinforce how things are going and make sure things are being done correctly. At the end of 3 months, you see me in the clinic, and as long as things look good, you can use the arm however you wish. We do keep an eye on you every year or two from there on out. So the typical follow-up schedule after that is I see patients at 1 year, 2 years, 5, 10, and so forth. So just to review the risks of the operation, the risk of a blood transfusion is pretty uncommon, only about 3%. Infection is 1%. Damage to the nerves and blood vessels or muscles or tendons, all that's less than a 1% chance of any sort of permanent injury. The main thing we worry about over time is that for some types of shoulder replacements, the rotator cuff, which is the set of tendons around the shoulder that helps us move the arm, if that wears out, then that can cause patients problems after certain types of shoulder replacements. And that can come to more surgery down the road. When we've looked at it, overall the risk of another operation is about 5% after an initial shoulder replacement. If we tell you there's a 90% chance that you'll be happy after a shoulder replacement, that's a nice way of saying there's a 10% chance you won't be. And that can be for whatever reason sometimes, and frankly we don't always have a great understanding of why that is. The last issue is the anesthesia problems that can happen due to heart problems or lung problems after surgery. Everybody is justifiably concerned about pain after shoulder surgery, and we have put a lot of research into this over the last 10 or 12 years. Happily, we have our pain level down to about 3 out of 10 on the day after surgery, which is typically the worst pain that patients have. We do a long-acting injection of local anesthetic during the operation, which is pretty good for several days after surgery. And then you go home with 4 prescriptions for different pain medicines that all hit the pain at different places in the cycle. This is called multimodal pain management. And again, when we've studied this on numerous occasions, this has been very effective for bringing the pain down from where it was even 10 or 12 years ago. Finally, perhaps the most important thing to know is that you'll have my card. It has my number, and we are always available to you. The number is a direct line to my assistant. And if there's any problems, you can always give us a call after surgery.